A very good afternoon to everyone. Thank you very much for staying on. I know it is a very long day, but my presentation will be on a lighter side, right? So like the introduction, of course, we are a research institute. However, what I want to share today would be more towards, the challenges that we face, and I'm sure the new culture collections can relate very well with what I'm going to present. Right, so a little bit of background of University Putra, Malaysia, that is where Institute of Bioscience is situated. So we have, so it is in Serdang, so it is, if you land in KLIA, Kuala Lumpur International Airport, is just about 45 minutes away, so welcome to come and visit us. And we also have a branch which is in the Borneo side, yeah. And then we have a total of 1,800 academic staff and 5,300 non-academic staff. And the UPM is a very, very big university, one of the research university in Malaysia. So there are 15 faculties, 23 centers, and 11 institutes. So we are here. So for your information, faculties normally, they will focus more onto academic programs for undergraduates, while we at the institute, we focus more towards research as well as postgraduate research. Okay, so in terms of international ranking for UPM, so we are 148 world university ranking. I guess, many of the universities in Asia, and, we are looking into this game, looking at rankings, QS ranking. And we are the top 200 for 70 subjects, including agriculture. And then also in ASEAN university ranking, we are at the 20th. Right, so moving on to Institute of Bioscience. So this is our name of the institute. So we are 4 laboratories and 4 units. And we are very proud to be the first recognized institute as by the Ministry of Higher Education, where we focus on animal vaccine and therapeutics, mainly on poultry vaccines and therapeutics, as well as fish, aquaculture. Right? And then our niche area is biomedicine and therapeutics, and we have 4 labs here. So each lab, they will focus on different areas. So if you can see here, we work with cancer. So it's not only human cancer, but also comparative cancer, which means cancer in animals. And then we have natural medicine products research laboratory, which is called Nature Meds. And we also have a conservatory park, which we plant more than 600 indigenous plants found all over Malaysia. And then, so these 2 labs, which is called the Aqua Health and Vac Bio. So the Aqua Health focuses on the fish vaccine and diagnostics, and then we have the Vac Bio, which focuses on the poultry side, right? So this one focuses on research, and then on this side, you'll be able to see the 4 strategic units. So our strategic units, we focus onto services, and this is where our UPM microbial culture collection is situated. So we don't do research here. So mainly if the researchers dealing with cultures and whatnot, it will be done by these 4 labs. But here we offer more towards like services, and I can tell you more afterwards. Right, the journey. So like what Dr. Lily mentioned just now, so we are taking small steps, hoping that, we'll make big impacts. Small steps, in the end, hoping, big things will happen. So we started off in 2008, so we are not that old. And you can see here, this is our journey. And then we are recognized as the strategic unit. So, people who have been with ACM for a long time, you have known us as UniCC. And we have rebranded ourselves as UPM-MCC, University Putra Malaysia, Microbial Culture Collection, when we were putting in the initiative to become the first national depository authority in Malaysia. right? So, we have, making networkings and all that. I guess, for new culture collections, that is very, very important. Networking, to know people, not only through emails. I guess it's very important for us to know the person themselves. That is why, like I said, UPM, this year we have 4 delegates because we really need to know people, physically, because there will be a different wavelength whenever we communicate with them later. Right, so UPM-MCC on 26th of March 2024, we have been gazetted at the first National Depository Authority by MIPO, that is the Malaysian Intellectual Property Office. And a few months after that, so we were surprised that WIPO also came over. So we were very excited and see, how we can move forward with that. Okay, we're a very, very small unit indeed. So this is our organization chart. So there are only 5 of us. So 4 of us are here. So, like only one person is there dealing, because, we are very small. Yeah, and we are very fortunate that we have our international associates that help us, give us advice and whatnot. So first is that we have our international research associate, Ms. Swani Johamita from TBRC. So she has completed her first term. So we wanted to appoint her for the second term. So now we are sending her the letter of offer. And then this year, we managed also to get Dr. Raquel Hurtado Ortiza, who is the director for the National Collection Cultures of Microorganisms in Institute Pasteur. Okay, right. So services in UPM. So we are self-sustaining unit. Okay, we do not have that much of support from the university or from the government. So we have to offer services so that we can manage our own unit. Okay, so what we do is that we offer services to the scientific community working in universities, research institutes, as well as industries. We also offer workshops, seminars, symposium, as well as training programs. Okay, in terms of culture collection, we are building up. So if you see here, the total of cultures that we maintain now, it's about 1,500 strains, and mainly they come from our own researchers. But we are open for people who like to deposit with us. Right, so our services is, as such, we have public deposit, which we offer only for UPM depositor, and then safe deposit, patent deposit, this is new. And then we also do services for preservation of microbes and also microorganism supply. And for depository, we only receive, for now, is only bacteria, and then we wanted to expand to fungus later, and only risk group 1 and 2 bacteria for now, sources from environment, food, as well as agriculture. Okay, and we are also building up a catalog, so everything is done in-house, so we are doing this at the moment. Okay, and other services, actually, depositing fees for bacteria depository is not that much. So we have to also support with other kinds of services, and these are the other kinds of services that we do, the MIC, MBC, and also identification from non-clinical samples, as well as determination of antimicrobial properties from compound. Right. Okay, so these are some of the activities. Oops, sorry. Okay, so these are some of the activities that we do. So training, seminar, public lectures, and then we also do webinars. So our new associate advisor, Dr. Raquel, just contributed for her webinar last month. Okay, and then, so we also do community services to the community. So this is in line with our government's initiative for encouraging kids towards science and technology. Okay, so this is, I just like to share the journey that we have gone through in order for us to get the NDA. So as you see, we are only like five person, and myself, I'm the director, and Professor Ina, she is the deputy director. So there's only basically 3 people who is focusing, doing 100% of their time managing culture collection. So, so we have gone through the journey of you know, getting people to come over, and it's not really an audit, right? So it's for them to come and see whether are we ready or not to become the NDA and things like that. So this was the journey to see the readiness, and then of course the applications, the approvals and whatnot, and then we managed to get the recognition. Okay, so so before we embark on that journey, we wanted also to see, so you might be wondering, in Malaysia, like how many culture collections are there? Because, you know, members of ACM, there are only 2, right? Ourselves and also Mardi. So we also went to benchmark ourselves. Where are we, you know, in Malaysia? And then we do the facilities readiness and see, and then human resource, and then we also develop procedures. So this one I think is very, very important in the sense that, of course, UPM, we are certified with ISO 9001, but it does not expand to the culture collection. So we have developed, you know, with our little experience with 9001, so we embarked and developed these procedures, and this was also like verified or by our MIPO, and to see whether are we able or not to be regarded as NDA. Right. So this is the patent deposit. Okay, so I guess I do not need to go through the slide. And this is just sharing the procedures of deposition. Okay, so this is step by step. So I guess many of you are IDA, so I guess this one is very familiar to you, right? But I guess for any of the new culture collection, if you like to you know, get the slides, I'm very happy to share it with you. Okay, now the challenges and way forward. What are we facing, or what have we faced all the while? Okay. So of course, you know, to adhere or to comply with the local and international regulations. So one is the Biosafety Act 2007. So that one governs all the research or microbes which has been modified, LMO, GMO. So that is one of our challenges as well, yeah. And then, of course, the access benefit sharing. So the custodian of ABS and Biosafety Act is in different sections, so that makes things quite difficult, yeah, because researchers, they wouldn't know the, you know, there's no like a big framework that guide researchers on what you need to do, which departments or ministry that they have to apply for approvals first and foremost. Okay, so that is the one which is in place with which is the Biosafety Act and also the ABS. But Malaysia is also coming up with a new act. So this is the CBWT Act, yeah, BWTC, sorry. So this is in Malay. So this has been, the policy has been approved by the government of Malaysia. So the act is in progress. So we foresee that it will be becoming an act, I think maybe in 2 to 3 years' time. So by having this, meaning, you know, we have to comply not only with the GMO, LMO, and then also with sharing, the excess benefit sharing, and then also with the non-GMO, which I think many or majority of the researchers are working with non-GMOs. Okay, so this is just sharing, you know, our Biosafety Act. You know, what is the penalty if you do not comply, you know, in terms of fine and whatnot. Yeah, so they are being very serious now because the act has been placed for quite some time. And you can see the fine is quite a lot. If you divide by 4, it's like 40,000 USD here, fine to the individual, right? And to the government, to the institution, it will be more than 100,000 USD here. And this is what the biosecurity policy just now with the Biological Toxin Act, which will be in place, I think, in 2-3 years' time. So in 2023, it has passed this is in Malay, but it's the meeting for all the ministers and whatnot. Right, so this is the other challenges that we have, okay? Operational challenges, infrastructure and facility, being a self-sustained unit. I guess this is one of the stumbling blocks that we have. And also the financial sustainability, yeah? To get enough money, to roll, to manage the unit. Human resource under staff, you can see the numbers of staff that we have. Skilled personnel, very, very important, and retention and turnover. Yeah, because once we have trained one person, so we don't want that skilled personnel to move. One is because it's not easy to train, with all the regulations and whatnot, but as well as the responsibility as the NDA to manage the cultures for at least 30 years. So we cannot take that risk, right? So retention and turnover, because, I think in many countries, once you get promoted, you will be like moved to another section, to do more admin work and whatnot. But I don't think, this will apply to culture collections. And of course, technology challenges. Our equipment is outdated, and then we have to wait, for quite some time, in order for us to have enough budget to change or upgrade our equipment. Right, and then moving forward, what do we foresee in the near future? So, I'm very looking forward with the ISO 2003-87. So even though the accreditation is still a long way, but we want to see how best we can follow the classes. And then 17025, some of our labs do have 17025, but not yet in our culture collection. And then with IDA, we intend to do a gap analysis with the current NDA as well as the IDA, and see, if it is possible for us to plan ahead for that. So that is in our strategic planning. And then, okay, a little bit about national biorepository policy. So for information, Malaysia also has appointed a working committee at the national level for the establishment of the national biorepository policy for Malaysia. So that has been established in 2023, and 2 of us from the UPM-MCC has been appointed to be together with the task force at the national level. So this is the status, just to share with you. In Malaysia, actually, we only have 15 culture collection, and each of the culture collection, they focus on certain areas. So it's not stated here, right? So let's say plant bank, for instance, so it is more towards like microbes or things related with plants and whatnot, okay? And public university, there are 1, 2, 3, 4, 5 there, and we are in number 6 there, yeah? Okay, in terms of, all the 15, the microbes that we have are properly managed by all these 15 culture collections is less than 10,000 strains. And biospecimens, because we wanted to do a biobank for Malaysia, so this is the number. Yeah, and then for molecular material is this number, as well as algae and microalgae is 250 strains, right? So we want to also establish, what will be the best model for biorepository. So that one is ongoing. So we're thinking about, looking at other biobanks in globally. So there are a few models, and we feel that the network model will be the best. Yeah. So I guess we'll get advice from the experts here as well as our friends globally, and see which one will work best. But we have discussed and we look like this one will be the most feasible one, the network model, right?
Dr. Sunita?
Yeah, it's done.
Time's up.
Oh,
Yes.
sorry. Okay, so this is the end, I guess. Oh, so this is just the linkages that we have, yeah? And I just want to share this one. So this has taken place yesterday. So strengthening collaboration, UPM and WDCM. So Dr. Wikian from IMCAS and Dr. Ma was there to renew our collaboration. So thank you very much.
Thank you very much.